I went into family medicine after going to medical school at a place that didn't even have a department of family medicine in it. And, you know, most of my professors and colleagues told me I was crazy, but I thought the writing was on the wall 27 years ago that this had to change. Just this morning, I saw patients, and the first patient I saw this morning, it stopped her when she had coronary disease and has had blood vessel problems. She had to stop the medicine because she couldn't afford it anymore. I saw a 44-year-old man this morning whose blood pressure was 204 over 140, and probably had a small stroke last week. And we got it down with samples of medication, but I don't know where we're going to go from there. I saw a woman who's going to have surgery in 2 weeks who's likely to get wound infection and other complications because she can't afford her insulin anymore, and she decided she's going to have to stop it. I mean, that's just this morning. I mean, I see this every day, and the stories that I hear about people not having insurance and having to help me sit down with them and figure out what medicines that they really have to have and which ones they can do without, and what can you do for me in the next 2 months because I'm going to lose my insurance in a couple of months. It goes on and on. So I mean, if you need to be fired up about doing something about this, what you heard tonight is not you know, an exception. It is becoming incredibly common, and I'm seeing it every day. But the thing that's most heartbreaking to me about what's happening is that I don't think this issue is really boils down to the need for insurance reform as much as it is a need for the health system reform, and that's not colleagues who've been to medical school graduations recently where speakers have asked, how many of you are going into primary care? And out of the classes of 300 or 400, you know, 4 or 5 people will raise their hand. I mean, we are in big trouble if that's where we're headed as a nation. So I know some of that is being talked about, and some of it's being discussed in some of the health care reform, but I don't see much of it happening. And I think that's what's going to control our costs. It's the relationships that you have with the doctor that you know and who knows you, and his focus on being able to coordinate your care, and whose focus is also one in which there isn't an incentive to do more and spend more that I think is going to result in something really, really happening.